Well, we never had an aspiration to acquire Scarborough Hospital, but we got involved at quite an early stage in discussing the future of that hospital. One thing led to another, and we were asked whether we would be receptive to the idea of acquiring Scarborough. And following sort of intense board consideration, we agreed to do so. My experience since then has been extremely positive. I mean, we engaged with the organisation some 15 months before the acquisition. The clinical teams, the staff within Scarborough Hospital are extremely willing to engage with the acquisition, extremely supportive of the ambition around the acquisition. And equally, our clinical teams in York have engaged with the process enthusiastically to a degree. I mean, there is always going to be a difficulty with two hospitals 45 miles apart, different cultures, different climates, wondering what might be in it for them. But generally it's been a positive experience, and certainly in the current climate, it's given us a purpose around change, a purpose to change, if you like, at a time when the financial environment and clinical environment is extremely difficult. Well, initially there was a lot of suspicion, certainly in the Scarborough locality, about the change. They've had many, many years of poor experience, if you like, particularly around decision making around the future of clinical services on the east coast of North Yorkshire. So clearly suspicion, clearly worried about a hospital 40 miles away taking over their local hospital, clearly worries about the potential centralisation of services in York. They need to travel links are very poor. Having said that, we got involved with patients and our staff over in Scarborough at a very early stage. Focus the whole debate around the values of the organisation. Those values centre around the patient need, and in that light I was able to convince people that we simply would not look to expect patients to travel unnecessarily 40 miles for services that we can provide in Scarborough. And indeed, our ambition around the acquisition was to improve the level of provision in Scarborough to avoid that travelling to York and further afield for basic services. Well, factually, it's had, the trust has increased significantly. We were a £290 million trust before the acquisition, and we're now a £400 million trust. So in terms of size and scale, we're a much more significant organisation. It's given us opportunities to look at whether or not we can strengthen our clinical services through having a greater number of clinicians at our disposal, having greater resources to work with, and also having a greater clinical mass to allow us to develop our services at an ever more subspecialist level. So in many respects, it's had a very positive impact on the organisation. Having said that, no merger of two organisations is a simple trick. We've set ourselves a programme of change over 5 years, and I expect ourselves to go one step back, 2 steps forward, and vice versa throughout that process. Hospitals are not some sort of generic provider of very complex organisations, many interdependent services being provided, and every one of those will have its own unique challenge. And it's about attention to detail, it's about communication, it's about leadership, and it's about engagement. And with that, I think you can turn it into a positive experience. Well, be very clear about what it is you want to achieve. A merger or an acquisition is not a solution to an insoluble problem. So we were very clear that the acquisition of Scarborough would provide the opportunity, with support from the Strategic Health Authority and the Department of Health, to improve the provision in Scarborough and in turn improve the provision in York. Our whole objective was around clinical quality, improving the standards of the services on offer. Being very clear about that then leads to the process that you're involved in, the way you can engage with people. But if there is any lack of clarity, I would suggest it's not a solution.